my God. Kakasulina.
To a group of postpartum mothers. This is considered huge level of preventive care. One is primary prevention. In Canada's early days, after training as died, schools of nursing nurses work in as privatized treating nurse, which foundational document initiated the shift of preventive care to holistic health commercial-based care in Canada. Answer: Public Health Agency of Canada, 2000. Next, a CHN cannot be an expert in all areas to deal with this. The CHN needs to do all of the following except answer: working closely with a midwife. Next, which of the following is not a community health nursing system setting? Dialysis. That works in and with communities best described. Works in and with communities best described community health nursing. The 5 rules of nursing include promotive, preventative, curative, rehabilitative, and supportive. The rehabilitative level of care focuses on restoration to optimal level of infection. Tama. The best example of primary care is emergency department,
In 700 meters,
where
take the
assessing
left,
and
on the right,
evaluate
to Highway 2 South, then keep right.
a complete picture of nurse situation would require an assessment including determinants of health. Correct. Next, the first public health issue dealt with in Canada were infectious disease. Next, secondary prevention activities are most closely related to which stage of the natural history of disease? Pathogenesis. Teaching new parents to place their babies in the supine position to sleep is an example of teaching secondary prevention. Ay, mali. Teaching new parents to place their babies in the supine position to sleep is an example of primary prevention. Public health nurses, occupational health nurses, and outpost nurses have this in common. condition to a group of postpartum mothers. This is considered which level of preventive care? One is primary prevention. In Canada's early days, after training in schools of nursing, most nurses worked in as private nurse duty nurse. Which foundational document initiated the shift from curative care to holistic health promotion-based care in Canada? Answer: Public Health Agency of Canada 2002. Next, a CHN cannot be an expert in all areas to deal with this. The CHN needs to do all of the following except answer: working closely with a medical doctor. Next, which of the following is not a community health nursing setting? Dialysis. Okay. Works in and with communities best described. Works in and with communities best described community health nursing. The 5 levels of healthcare include promotive, preventative, curative, rehabilitative, and supportive. The rehabilitative level of care focuses on restoration to optimal level of function. The best example of primary care is emergency department. When assessing an unemployed 18-year-old mother of 3 at the community health clinic, a complete picture of her situation would require an assessment including determinants of health. Correct. Next, the first public health issue dealt with in Canada were infectious disease. Next, secondary prevention activities are most closely related to which stage of the natural history of disease? Pathogenesis. Teaching new parents to place their babies in the supine position to sleep is an example of teaching a new secondary prevention. Ay, mali. Teaching new parents to place their babies in the supine position to sleep is an example of primary prevention teaching. Public health nurses, occupational health nurses, and outpost nurses have this in common. Have additional education requirement or specialty certificate required? Mali. Answer: are community health nurses. Next, primary healthcare principles include equitable distribution of resources, preventative rather than curative, individual and community involvement. Okay, next question. Which foundational document initiated a shift from curative care to holistic health promotion-based care in Canada? Answer: La Lundy Report 1970. Okay, home health care is expanding in the skies to shoulders hospital states. Which of the following statement is true regarding ethical decision-making process? Answer: if it considers ethical principles, client values and abilities, and professionals' obligation. Next, what are the components of ethical decision-making? 1. Consider ethical principles, client values, and professional obligation in an orderly process. Next, a primary objective for the home health nurse HHN is to facilitate which area? Self-care. Next, which term refers to shared and generational societal norms about what constitutes right or wrong? Answer: morals. Coordination of discharge planning, palliative care, and case management are all part of which of community health nursing? Home health. Roles for LPNs in community community health nursing include all following except case manager. Home health nurse contracts with clients, assists them with setting attainable health goals. What is occupational health? Involved in immunization, proper use of personal protective equipment, and health histories explain how it happens. What is parish nurse? Supports healthy curricularly fulfilling norms. What is public health nurse? Assists a new mother from depression and isolation and refers her to a community group. Which of the following is considered to be nursing first code of ethics? Answer: the right-handed pledge. Community health nursing includes which of the following roles? Counselor. According to the Canadian Nurses Association Code of Ethics for Registered Nurses, advocacy is a nursing responsibility. Similarly, the community health nursing standards and practice less advocacy as part of the CHN role. CHNs are carrying out their role as advocates when they do which of the following: participate in legislative and policy making activities that influence health determinants and access to services. One step of the ethical decision-making framework is to place a ethical issue or dilemma within a meaningful context. What is the rationale for the steps? Multiple factors affect the formulation and justification of ethical issues and dilemmas. Last, when working with a dying patient, the patient grapples with the problem of how much more can to give. What is our primary concern? Okay. Question number 1. A nurse's teaching the importance of childhood immunization to a group of postpartum mothers. This is considered which level of preventive care? 1 is primary prevention. In Canada's early days, after training in schools of nursing, most nurses work in as private nurse duty nurse. Which foundational document initiated the shift from curative care to holistic health promotion-based care in Canada? Answer: Public Health Agency of Canada, 2002. Next, a CHN cannot be an expert in all areas to deal with this. The CHN needs to do all of the following except Answer: working closely with a medical doctor. Next, which of the following is not a community health nursing setting? Dialysis. Okay. Works in and with communities, national societal norms about what constitutes right or wrong conduct. Answer: morals. What is right? Coordination of discharge planning, palliative care, and case management are all part of which of community health nursing? Home health. Roles for LPNs in community health nursing include all following except case manager. Home health nurse contracts with clients, assists them with setting attainable health goals. Okay. Question number 1. A nurse is teaching the importance of childhood immunization to a group of postpartum mothers. This is considered which level of preventive care? 1 is primary prevention. In Canada's early days, after training in schools of nursing, most nurses work in as private nurse duty nurse. Which foundational document initiated the shift from curative care to holistic health promotion-based care in Canada? Answer: Public Health Agency of Canada, 2002. Next, a CHN cannot be an expert in all areas to deal with this. The CHN needs to do all of the following except Answer: working closely with a medical doctor. Next, which of the following is not a community health nursing setting? Dialysis. Okay. Works in and with communities best described?
In 500
Works
meters,
in and with
make a
communities
U-turn,
best
then
described
keep
community
left.
health nursing. The 5 levels of healthcare include promotive, preventative, curative, rehabilitative, and supportive. The rehabilitative level of
When
care
possible,
focuses
make a
on
U-turn, then keep
restoration
left.
to optimal level of function. Tama. The best example of primary care is emergency department. Tama. When assessing an unemployed 18-year-old mother of 3 at a community health clinic, a complete picture of her situation would best describe works in and with communities best describe community health nursing. The 5 levels of healthcare include promotive, preventative, curative, rehabilitative, and supportive. The rehabilitative level of care focuses on restoration to optimal level of function. Tama. The best example of primary care is emergency department. Tama. When assessing an unemployed 18-year-old mother of 3 at a community health clinic, a complete picture of her situation would require an assessment including determinants of health. Which of the following is considered to be nursing first code of ethics? Answer: the Nightingale Pledge. Community health nursing includes which of the following roles? Counselor. According to the Canadian Nurses Association Codes of Ethics for Registered Nurses, advocacy is a nursing responsibility. Similarly, the Community Health Nursing Standards of Practice lists advocacy as part of the CHN role. CHNs are carrying out their role as advocates when they do which of the following: participate in legislative and policy-making activities that influence health determinants and access to services. One step of the ethical decision-making framework is to place an ethical issue or dilemma within a meaningful context. What is the rationale for these steps? Multiple factors affect the formulation and justification of ethical issues and dilemmas. Last, when working with a dying patient, the CHN grapples with the problem of how much morphine to give. What is our primary concern? Preventing respiratory depression or reducing suffering at end of life. This is an example of ethical dilemma. Unit 3. Community health nurses work with clients and employers that empower them to become part of the identification of their problems and participate in developing solutions using which health promotion strategy? Advocacy. Next. Literacy is linked to some of the determinants of health and associated with which one of the following outcomes? Health status. Which of the following strategies outlined by the Ottawa Charter for Health Promotion builds individual capacity and empower clients through health education? Developing personal skills. Jim, a community health nurse, senses from his co-workers non-verbal behavior that she doesn't like him because of his race. His best response is approach her with his observation and check out of his perception matches her intention. Next, in what order did the following views of health evolve? Biomedical, behavioral, and socio-environmental. The success of new ideas according to diffusion of innovation theory is must depend on similarity to the past way of doing things. Next, this is a review. Rules governing smoking in public places is an example of public policy. By asking clients how they prefer to be addressed and who makes health decisions in the family, the community health nurse is demonstrating cultural competence. Next, community health nurses need to be aware of changing patterns in the cultural composition of the community for which of the following reason. 2. Be proactive in the program planning. Next, according to the population health promotion model, which of the following is false? Focus is on individual behavior change. Next, the best approach when confronting someone about behavior you're uncomfortable with is focus on behavior, don't attack the person, use perception checking. Strategies that reduce negative health consequences of unhealthy behavior are called harm reduction. Unit 4. Community health nurses assess community health using the listed data except meet with community leaders after intervention is complete. Number 2. 2C and schedule a day to ride through a low-income community to better understand its boundaries as well as the trends, rhythms,